Assalamualaikum. I am Siti Aisyah binti Abdul Ghani, matrix number PEHP 24046233, Bachelor of Environmental Health and Safety. This is a presentation for practical training 1 and 2. Now I'm going to present practical training in operational area and health administration in Kota Kinabalu Area Health Office. Kota Kinabalu Area Health Office, located at Level 4, Block A, Kompleks Pentadbiran Kerajaan Persekutuan Sabah, plays a vital role in safeguarding environmental health for residents in Kota Kinabalu. Divided into 16 sub-districts of operational area, have 9 main units in inspectorate sector, led by an area health officer, 5 health clinics, 5 community clinics, and 5 rural clinics. This is 16 sub-district of operational area at Kota Kinabalu Area Health Office. This is 9 main units in inspectorate sector of Kota Kinabalu Area Health Office that will ensure optimal public health services. Communicable Disease Control Unit (CDC), Food Safety and Quality Unit (FSQ), Non-Communicable Disease Unit (NCD), Drinking Water Quality Control Unit (KMAM), Vector-Borne Disease Unit (RKPBV), Occupational and Environmental Health Unit (KPAS), Water Supply and Environmental Cleanliness Unit (BAKAS), Inspectorate and Legal Unit (UIP), and International Entry Point (PMA). This is role of Assistant Environmental Health Officer (AEHO) in each unit. In CDC, AEHO responsible of monitoring all types of diseases listed in the Prevention and Control Infectious Disease Act 1988 Act 342. In FSQ, AEHO focus on safeguarding public health by ensuring that all food available within the district is safe, wholesome, and meets established quality standards. And in CD, addresses the prevention and control of non-communicable disease, focusing on health promotion and early detection. In KMAM, AEHO ensures the safety and quality of drinking water within the district, aiming to protect public health from waterborne disease and chemical contamination. In RKPVV, AEHO controlling and preventing diseases spread by vectors such as mosquitoes. In KPAS, AEHO ensures workplace safety, maintain the highest level of physical, mental, and social condition, and ensure the health and safety of employees. In BAKAS, AEHO improving the health of rural residents through controlled environmental health. In UIP, AEHO ensures enforcement of public health laws and regulations, providing oversight and legal support for compliance with environmental health standards. In PMA, AEHO ensures all travelers' flight ships in trader compliance with international health regulation. This is some government department with their relationship with environment health. Sabah National Security Council. They managing and coordinating action during crisis or disasters, including natural disaster and security incident. They also monitoring and ensure the security of state borders, especially in maritime and land areas border neighboring countries. Relationship with environmental health. In natural disaster situations like landslide, earthquake, or floods, MKN plays an important role in ensuring a safe and healthy environment for victims, including the provision of basic facilities in disease control. They're declaring an emergency against something that threatens security, economic life, and public order, such as the occurrence of an infectious disease in the country, such as COVID-19. Kota Kinabalu City Halls (DBKK) tasked with delivering a wide range of essential municipal services to its residents, ensuring the city's growth, cleanliness, and overall well-being. Relationship with environmental health, collaborating with health authorities to inspect food establishments and enforce hygiene standards, safeguarding residents against foodborne illnesses. Coordinating with health and emergency services to mitigate the impact of natural disaster or public health crisis, ensuring timely action to protect residents. Sabah Attorney General Chamber. The AGC represents the government in civil proceedings and advises on civil matters involving the state. The AGC is responsible for drafting legislation and ensuring that laws are consistent with the federal constitution. Relationship with environmental health. The AGC plays a crucial role in public health by providing legal support in the formulation and enforcement of health-related laws and regulations. By ensuring the legality and constitutionality of public health laws, the AGC helps protect public health and safety. Sabah Immigration Department. The issuance of passport and travel documents such as visa, pass, and permit management. They monitoring and managing entry and exit point, enforcement of immigration law. Relationship with environmental health. They collaborate with health authorities to screen for diseases like COVID-19 at points of entry. Ensure that displaced persons of refugees entering Malaysia placed in detention centers adhere to health and safety standards. This is a private sector service with relationship with environmental health. Sudafiat Sendirian Berhad, which is hospital support services. They provide comprehensive solution for hospital support services, including maintenance, engineering, cleaning, linen and laundry, and healthcare waste management. Relationship with environmental health. They ensure proper medical waste management, maintains hygienic hospital environment, and improve indoor air quality to prevent contamination, reduce disease transmission, and promote public health. Pos Malaysia Sendirian Berhad, which is postal services. They handles mails and parcel delivery, express services through Pos Laju and logistic solution. They also handle bill payment, remittance, insurance, government services, and support e-commerce with integrated logistics. They also have commemorative stamp and pelagic product. Relationship with environmental health. They deliver in months health inspection notice, clinical and food samples, and other official correspondence. This is a voluntary body with their relationship with environmental health. The Society for the Prevention of Cruelty to Animals, Kota Kinabalu, SPCA-KK. They promote a better understanding on the needs and rights of animals in order to reduce the incidence of animal abuses. Relationship with environmental health. They raises awareness about the link between animal welfare and environmental health. Includes educating the public on the importance of vaccination and disease prevention, which has broader implications for community health. Now I'm presenting CDC disease investigation in hepatitis A. A patient name is MHFS due to confidential information. Nationality Malaysian, 27 years old, male, work as healthcare assistant in Hospital Angkatan Tentera, live in Kampung Kuala Baru, Sabah, Port Road, onset on 18 November 2024. He has symptom fever on 18 November, heartburn on 18 November, with T-color urine 8 November, and developed jaundice on 20 November. This close contact have 11 people in one house, but all asymptomatic and still healthy. Their water source, Jabatan Bekalan Air Sabah, JBA, and they use flush toilet. Food history. Routine. His father-in-law buys fish in bulk every week to be used as a side dish at home because it is more economical and cheaper. The main food at home is fried fish. This case always ate excessive patient food in the Hospital Angkatan Tentera Navy. On 6 November, his father-in-law bought clams that had been picked at Safma Keke. The clams are boiled. Only 4 people ate the clams and all of them had no symptoms. Other menu, rice, fish, soup, and vegetable. On 7 to 9 November, they just ate homemade pineapple cucumber pickles, fried fish, vegetable, and rice. On 11 November, this guest eat lato that washed and eaten with sambal, both at the KK market. On 15 November, this guest ate mixed rice, fried chicken, and fried fish in Vivi Sulaman restaurant. And 18 November, the symptoms develop. Conclusion: infection may start long before because the routine buys fish bulk. This is vector disease investigation for dengue. A patient name is NSMF due to confidential information. Malaysian, 30 years old, female, work as clerk at IPD Kota Kinabalu and live at Quarters Police Kepayan because her husband is a policeman. Onset on 20 December 2024. Her symptom, fever on 20 December, joint pain on 21 December, and developed rashes on 21 December. Her close contact, just 2 people, husband and son, all asymptomatic and healthy. The water source is JBA, Jabatan Bekalan Air, and they use flush toilet. This is her travel history. Her routine, she worked on 8 a.m. until 5 p.m. on weekdays. Then before that, she sent her son to daycare center on 7 a.m. and takes him back on 5:30 p.m. On 7 December, she just stayed at home while cleaning the yard all day with her husband. And 8 December, she continued cleaning the yard on the morning, and then on the evening, they went to Tanjung Aru Beach 2 for a picnic. On 15 to 16 December, they went back to parent house at Kampung Cahaya, Kota Kinabalu, and the parent is asymptomatic and still healthy. And 20 December, developed the symptom. So conclusion, the infections may start on 7 December when cleaning the yard.